Diseases of the nervous system include conditions like epilepsy, defined as recurrent seizures resulting from abnormal and excessive neuronal discharge. Epileptic seizures are characterized by loss of control, an episodic nature with sudden onset and termination, and a repetitive clinical pattern. Seizures are categorized as localized, caused by an epileptic focus that does not spread, or generalized, where abnormal impulses originate from and spread throughout the cerebral cortex. Localized epilepsy originates from a specific area of the cerebral cortex and remains confined to that region. Generalized epilepsy involves abnormal impulses originating from and spreading throughout the cerebral cortex. The etiology of epilepsy includes genetics in some breeds, infections like distemper or toxoplasma, head trauma, neoplasia, and inflammatory conditions. Other causes include idiopathic factors, metabolic issues like hypocalcemia or hypoglycemia, organ dysfunction, and lead intoxication. Clinical signs of epilepsy can include localized motor activity, such as tonic seizures of one leg or facial twitching, and autonomic signs like pupil dilation, salivation, or vomiting. This image illustrates a tonic seizure in the limbs. Dilated eye pupils can also be a sign of epilepsy. Diagnosis involves a detailed case history, observing clinical signs, and laboratory tests such as urinalysis and serum checks for hypocalcemia or hypoglycemia. Radiographs can detect fractures, trauma, or neoplasia. Treatment focuses on the primary cause and the use of anti-epileptic drugs. Common medications include phenobarbital, potassium bromide, primidone, and phenytoin. Narcolepsy is a neurological disorder with abnormalities in rapid eye movement sleep, leading to excessive daytime sleepiness. A dominant sign is cataplexy, sudden attacks of flaccid paralysis with maintained consciousness. The etiology of narcolepsy involves an imbalance between cholinergic and catecholaminergic neurotransmitter systems within the central nervous system. This imbalance can be due to diffuse encephalitis, canine distemper, or genetic predisposition. Clinical signs include rapid eye movement during sleep, excessive daytime sleeping, muscular twitching, and flaccid paralysis or cataplexy. Attacks can often be induced by exercise or eating. This image depicts sudden bouts of deep sleep associated with narcolepsy. Diagnosis relies on history, clinical signs, and a stimulation test, such as giving an affected dog food, which often induces an attack. Treatment includes intravenous imipramine, an antidepressant that helps regulate neurotransmitter balance, and atropine sulfate. Meningitis is the inflammation of the brain's meninges. It can extend to involve the brain or spinal cord, characterized by hyperesthesia and neck rigidity, typically seen in adult dogs. Bacterial infections are a common cause, often spreading hematogenously from distant foci, by direct extension from adjacent structures, via trauma, along nerve roots, or through contaminated instruments. Bacteria frequently causing meningitis include Pasteurella, Staphylococcus, Actinomyces, Nocardia, Escherichia coli, Streptococcus, and Klebsiella species. Other causes of meningitis include viral infections, such as canine distemper and feline infectious peritonitis, and mycotic infections like histoplasmosis and cryptococcosis. Clinical signs include hyperesthesia, fever, cervical pain, and rigidity. Other observations can be vomiting, bradycardia, anorexia, and sometimes seizures or cranial nerve deficits. This image shows congested mucous membranes, which can indicate fever associated with meningitis. Rigidity in the neck is a key clinical sign of meningitis. Diagnosis involves case history, clinical signs, and CSF examination for color, protein, gram stain, and cell content, looking for neutrophilia if bacteria is the cause. Treatment includes antibacterial drugs that can pass the blood-brain barrier, such as chloramphenicol and metronidazole. Anticonvulsants like diazepam and anti-inflammatory drugs like prednisone are also used. Osmotic diuretics may manage increased intracranial pressure. Encephalitis is inflammation of the brain tissue. It may extend to the spinal cord, causing signs like seizures, circling, and blindness in dogs. Etiology includes viral causes like canine distemper and rabies. Other causes are granulomatous encephalitis, parasitic infections like Dirofilaria immitis, and genetic conditions. Clinical signs include seizures, depression, abnormal gait, blindness, and walking in circles. Behavioral changes like staring into space or head pressing, ataxia, and intermittent screaming may also occur. Diagnosis is challenging due to overlapping symptoms with other CNS diseases. Testing spinal fluid and advanced imaging like MRI can help. Post-mortem diagnosis is common, but immunofluorescent techniques can detect viral antigens. Treatment involves anticonvulsants like phenobarbital to control seizures and anti-inflammatory drugs such as oral prednisone. Specific treatments like amphotericin B for mycotic encephalitis or ivermectin for parasitic causes may be administered. Feline spongiform encephalopathy, or FSE, is a specific brain disease in cats related to bovine spongiform encephalopathy, or BSE, and scrapie in sheep. FSE is caused by oral exposure to foodstuffs derived from BSE-contaminated cattle. The infectious agent is a protease-resistant prion protein that accumulates in the affected brain tissue. Clinical signs include muscle tremors, ataxia, dilated pupils, and behavioral abnormalities like uncharacteristic aggression. Affected cats may exhibit hyperesthesia, excessive grooming, and, quote, kangaroo-like movements. Diagnosis is based on history, clinical signs, and microscopic examination. Microscopic analysis reveals diffuse vacuolation of the gray matter and neurons, especially in the cerebral cortex. There is no treatment for FSE, and the prognosis is poor, as all spongiform encephalopathy cases are fatal. This final scene is a placeholder for any questions you might have about the video content. Diagnosis is based on history, clinical signs, and microscopic examination. Microscopic analysis reveals diffuse vacuolation of the gray matter and neurons, especially in the cerebral cortex. There is no treatment for FSE, and the prognosis is poor, as all spongiform encephalopathy cases are fatal. This final scene is a placeholder for any questions you might have about the video content.